Affordable, equitable, and effective healthcare begins in the community. The community is the foundation, what we call level 1 of the health system in Kenya. My work is to support the community health volunteers deliver high-quality healthcare services in the community, and I oversee 28 community health volunteers. When I arrive at work in the morning, I do a brief catch-up with my colleagues, check on my dashboard for my performance. Then I check on the Supervisor's app. The data on the Supervisor's app guides me on prioritizing, work planning, and ways to support my CHWs even better. I proceed with the phone calls and plan for the daily activities.
Hello.
Rosa, habari asubuhi?
Mzuri.
Umeshajitayarisha?
Niko kwa samba, si unaweza kunipatia tu masaa mawili alafu nikuje? Si tukutane hapa tu kwa junction. Hapo kwa maduka yetu hapo kwa kona.
The Supervisor's app is integrated with the community health worker smart health app. There is real-time visibility of the CHV work on the Supervisor's app. The app has a checklist. The checklist helps me decide on the community health volunteer to support remotely and the community health volunteer to support in-person field visits.
Mimi nafurahia sana kazi ambayo supervisor wangu ananifanyia. Siku ya in-service tunafanya anatupeleka tu kwa niseme ni kosi kwa sababu anatufundisha vitu mingi ambao tumeweza kusahau huko nyuma.
And 5 positive diagnosis yako ni chini. Assessments ni mingi lakini
kuna supervision nyingi ambazo huwa napata kutoka kwa supervisor wangu. Kwa hiyo nashukuru kabisa, hii remote supervision pia imenisaidia kwa sababu saa zingine naweza nimesahau kidogo. Alafu napata simu huwa inanikumbusha kabisa. Alafu naenda natembelea huyo client.
In the previous version of the Supervisor app, it essentially allowed the supervisor to conduct only in-person supervision, but not in a detailed manner, and much of the CHB performance was available on the dashboard. I'm happy to say the challenges are a thing of the past now. I'm able to see everything I need in one place. The Supervisor app enables me to conduct remote supervision, view historical KPI for the community health volunteers, and provide personalized mentorship. I'm also able to monitor the weekly and monthly performance through the introduction of the community health volunteer scorecard. The advantage of the new Supervisor application is that we can now view our own performance and performance of our individual team members displayed on the contact cards. In addition, the task reminders ensure that we prioritize support to CHVs with upcoming or missed high-impact visits like PNC. In the middle of every month, the app reminds me to visit all CHVs not yet visited that month. This has improved how I make my weekly plans in order to achieve set targets. It has really transformed how we work.
Busia County for Living Goods, it is an innovation hub where we are doing several experiments and innovation in conjunction with the county government to inform scale up. This is one of the things we have been developing and testing with funding from the Pfizer grant. During this COVID period, we have been able to assess over 1 million children, and we have been also able to save between 17,000 to 19,000 lives, both in Kenya and Uganda, in the year 2020, and this double the number that we were able to save in the previous year. In terms of supervision rates, this app has really assisted us to have very high numbers of supervision, with the current rate of above 90% supervision rate.
During the design process of the Supervise application, we had to have the user in mind as the end user of this product, and as such, this helped us have a user-centered approach, which helped us and shaped us into creating a one-stop framework for performance management. We successfully consolidated and added all the performance data to the application, and as such, provided GPS capability to optimize field supervision for CHWs. However, the main challenge with these projects was integrating reliable and accurate GPS coordinates into the application, which entirely depend on the network strength and the device on the ground. The tech team is looking at innovative and analytic ways to fill the GPS gap.
Through the living goods model, we've been able to maximize on the availability and the support of the CHWs. We've been able to capacity build them and be able to supervise them ably, individually, on a timely basis, and for them to provide us with the quality reports we are seeing is nothing but a huge investment on the part of our partners. I can see there's a bright future in community health if we sustain the gains we've made and if we build and leverage on the partnerships that we brought on board.
Digitally empowered supervisors ensure that the community health workers work optimally to save more lives. We ask our governments in Kenya and across Africa to invest in digitizing community health systems and resourcing community health workforce to deliver universal health coverage across the continent.